She's a fantastic bear anaesthetist. They're all very well trained. So she's maintaining Blue Bell at a nice depth so that she's going to stay nice and safe, but at the same time we can do all of our examination. So this is her routine health check. The bears undergo a routine health check every 2 years, and that's because they're very good at hiding disease. They've evolved in a way which means that they will never really show signs of outward pain or discomfort or disease. So the only way we get to have a really thorough investigation is by anaesthetizing them and doing the range of exams that we'll do today, of which you can do some of them.
Oh, cool.
So you'll see she's missing a limb. Some of our bears, I think it's about 20% of bears have had some sort of limb or digit amputation, and it's generally because they've been caught in a snare trap and then taken to a bear farm. So when she arrived, she was already missing her arm. And because she is missing her arm, she's at higher risk of developing arthritis, which she does have. So it's important for us to be able to manipulate her joints and just assess their range of motion, make sure that she doesn't have any pain or evidence of cervical compression.
Of course, sorry. Sorry.
Now, Fee is our second nurse today, and she's going to be placing the catheter. This goes into her vein, and it allows us to give her fluids when she's under the anaesthetic. And those fluids just to help maintain her blood pressure and keep her well hydrated. So Blue Bell is very nice and flexible in this hip and this knee joint. Very good. The other thing we do is have a really good feel of their abdomen. So the bears that have been used on bear bile farms are at much higher risk of developing liver cancer. And when they arrive from the farm, we do take their gallbladder out because it is so infected and diseased, but they still have the risk of chronic inflammation and cancer. So it's important that we be doing this really thorough examination on that abdomen. And what you can actually feel is a lot of scar tissue around this area, and you're more than welcome to come and have a touch once Fee's place the catheter in. But this scarring is as a result of the fistula tract that they create in order to extract the bile.
What is in the bile that is making the bile extract?
The bile has a lot of proteins and chemicals called bile acids. And these bile acids can have some medicinal properties. And so the bile is used to treat diseases in humans like liver disease and stasis of the gall and the bladder. And so it's used in traditional Chinese medicine to treat some of these conditions. However, we do have a really effective synthetic formula of the bile acids, which you find in bile, as well as 54 herbal alternatives which could be used instead of bear bile. So while we do know that the acids within the bear bile can be effective, there's far better products out there, which mean we don't ever need to be using bears. But fortunately, I can't feel anything abnormal in there apart from a big bladder. So she might pee during this procedure.
She's certainly going to pee. I was trying to get a picture of that.
So might be good for us.
Yes.
Yeah. Never seen a project that far, but you never know.
The pressure's too hard.
Yeah, but please come and have a feel if you'd like to. What you can do is you can kind of feel how the skin feels here, and it's got a bit of give. It's nice and supple. And then if you come up here, you feel that it feels a lot firmer.
This is why I could never be
This
a
is where all
vet.
the scar tissue
I
is.
can't handle
And the
that.
bears are very good at
I think you
developing
could,
scar
the
tissue.
more you do
This
it,
is
Oh,
how
it
they feel.
fascinated
They
you.
feel scarring.
I've always
This is what
wanted to
happens
be a
in
vet. I was
farms
going
as
to
well,
be a
because they
vet.
create a
I
whole
couldn't go
of
through
bile to be
it.
proud of, but of course it will
I
naturally
can't
make
do
you
it.
unscar. So it means that the farmers will have to keep potting and
Is your whole year now?
absolutely. So she's been here since 2006. Yeah, and she's had her gallbladder removed because her gallbladder was severely diseased when she arrived. And then that surgery actually involves us taking a big chunk of skin away so that we can take all of that infection and inflammation and scarring and and then we have to stitch it together again. But they do still have the scarring developing because they need to heal after that surgery as well. Yeah, you can just feel the difference between down here where no surgery and then up here where she's had surgery. Now Blue Bell is unique in the fact that she's missing both her eyes. She developed quite severe glaucoma and lens problems, which was causing a lot of pain but also blindness. So in order to relieve her pain, she's had both her eyes removed. But ordinarily the eye exam is a big part of the physical health check exam as well.
But she gets along just fine without her eyesight.
Really amazing.
You'll see them outside. It will show you, and you wouldn't even know that you were looking at blind bears. We were looking at one yesterday. I didn't know that she's blind. They just compensate superbly well for that lack of eyesight.
Very nice.
Good, amazing.
Yeah, I think it's just mainly just front leg.
Yeah, sure. Sorry. Sorry.
Who named her Blue Bell?
A UK celebrity called Paul Martin. You had a dog. You had a dog called Blue Bell.
Blue Bell ice cream in there.
Oh, really?
Blue Bell ice cream.
Which
is very famous in Texas.
Wow.
Yeah, just put a bit of lube onto the thermometer.
Okay, I'll stop the video here for now because this is going to take a while. So I'll turn it back on in the next stage. Okay, so bye for now.